Hi, welcome to the Robinson Lloyd Resiliency Group, where we empower students with proven solutions to help them optimize their potential to be better at home, at school, and in the world. Today, we'll be looking at mental health, and I have a very special guest, Dr. Ishrat Asif. She is the clinical director for our Resilient Stars program, and she also has her own private practice. And so Dr. Asif and I just happened to be chatting about the program and other things. And the whole topic of mental health, what is it? Why is there a stigma attached to it still? That came up, and we felt like, you know what, this is something for us to share with others, with our resilient stars, yourselves. And so Dr. Asif, please tell us a little bit more about yourself, your passion, and how you got involved in this work.
Oh, hi everyone. Yeah, hi Tanya. So basically, my passion is to understand human behavior. And that's why I did my PhD in psychology. And then when I came here in America, I did my master's in counseling, mental health counseling, because my passion is to help people to improve their mental health.
Excellent, excellent. And what is mental health? What is it? What is?
Yeah, so mental health is basically our emotional, social, and psychological well being. It affects how we behave, how we think, how we interact with people, and how we deal with the stress, basically. Yeah.
Got it, got it. So, of course, I'm asking you that as someone who's also into mental health and just really trying to find a way for a lay person, someone who has absolutely no experience with mental health, if we could just have like a concrete example of someone who's experiencing mental health stress. Like I'm thinking of a student because we work with students, and let's say a student, someone you know steps on their foot by accident, and they respond by attacking them physically, right? Would we say that is it a response to stress, or
Yeah.
is it?
Yeah, it's a response of stress, but it's not appropriate response. So what we do, we help students in school, basically where we work. We help students to learn tools, skills, positive coping skill to deal with those stress in a positive way, not in a negative way, and in
Yeah,
a socially appropriate way.
exactly. So what I'm hearing, for someone who knows nothing about mental health, we're thinking about responding in appropriate ways. We're thinking of responding also in socially in positive ways, right? So if someone steps on your foot and you respond to fight, then that's not going to be positive, and the consequences are also not going to be very positive. Thank you very
Mhm.
much, Dr. Sifa. The second question, you while we were chatting, you mentioned, you shared one of your experiences where you recognized that misunderstanding mental health is rather common. Do you
Mhm.
mind sharing that with the audience, with the YouTubers that we have?
Yeah, sure. I would love to share. Like people have misconceptions about mental health, and they assume that anybody who has mental issue, they are violent. They should be violent. They should behave like in a very abnormal manner.
Yes.
So my experience with one of my clients, when we asked her, "Do you have any mental issues?" And then the client responded, "No, I didn't have any." And then like when we asked like more question about the screening and everything, then her screening, the urine screening, came positive for benzodiazepine. So we asked like, from where did you get it? And the client said, oh, I have depression and anxiety, and that's my medication. So, this type of misconception, people don't think that depression or anxiety is mental health issues. They think, oh, if I have mental health issues, then I'm supposed to be like insane or like psychotic. Yeah.
Right, right. And when I wanted to differentiate too, when we talk about anxiety, because there's normal anxiety and then we have abnormal anxiety, right? So the normal anxiety would be, you have an exam and you're feeling a little nervous, but you still do your exam. Whereas when it gets abnormal, it's actually interfering with your daily life routine, right? It's affecting how you function. You feel like you can't do what you have to do, or fulfill your role obligations. And so that's how we differentiate, right? Between
Yeah. Uh-huh.
what's normal and what isn't. So, and that's a really good point, Dr. Asif. It's not just about being psychotic and being violent, but we could have things that we could just improve to optimize our mental health. Thank you so much for that really, really, really on point example. Which leads me to my next question. When would you advise, I'm going to ask you in two stages because I want to know when you would advise a parent to get help for their child, as well as when would you advise if an adult sort of lived life, reacting to things a certain way, having poor relationships, but they're still managing to succeed in some areas of their lives. At what point would an adult person sort of really need help? So we have the child, when would a parent know? And then when would an adult know it's appropriate to seek help?
Yeah, that's very good questions. Yeah, so I'll start with the child. So it's never too early to address these type of issues. Like if the child is having adjustment problem in school, or if the child is having a problem in dealing with the stress at home, or if the child is suffering from bullying or any other type of thing that is going on in school. So that's the time the parents should start looking for help, because if in the beginning it would not be taken care of or not be addressed, then it could lead severe mental illness. So that's why it's very important, if any parent or guardian sees that, oh, child has little more anxiety than normal, or having any problem dealing with the stress. For example, if the child is having uh, any test and he is overly anxious, that's not normal. Little anxiety is normal before any test. But if the child is overly anxious, then it's time to seek mental help.
And I'm thinking, as you said, overly anxious, I'm thinking perhaps the child started bedwetting, right? Sort of
Yes.
regressing, and they're not at the age appropriate behavior. I'm thinking afraid to leave the parent, that they don't want the parent to leave for work.
Yeah, and then if the child is not able to sleep whole night because tomorrow morning they have tests.
Right.
So this is the time it should be addressed.
Good. And I smile because I think that, the goal of the program is to really try to disrupt the trajectory of mental disorders, right? So we go into the schools, we take care of any barriers to access, and children get to learn tools that could help them and possibly just keep their trajectory or their path, on a healthy path, optimizing their health, right? Because they'll
Exactly.
know this is what I could do when I'm feeling this way or that way.
Yes,
So,
exactly.
we have one more question. Actually, in terms of the adults, do we have examples of when an adult should say, okay, it's time for me to talk to someone?
Yeah, because parenting in itself is stressful. So if anybody is like feeling anxious or too much stress handling those parenting issues, then that's the time they should seek mental health help, because parents are the model, and then kids just copy parents. They're the model.
Sure,
So if I'm
sure.
not able to handle my stress, I'm throwing too much tension, or like aggressive behavior
Yes.
or verbal abuse. So this is the time I should take care of myself as well, so my kids can, so I can provide a better model to my kids.
I'm glad that you said that, because what if screaming at your kids, punching them if you feel like they were disrespectful, knocking them down, what if that is considered normal to the parents? How would the parent know that's actually not normal to lose it on your children? How do
Yeah,
we?
yeah, it's a very good question, but most of the time it's cultural or as well. Like in some culture, it's okay to scream, to talk very loudly, but we don't understand that, okay, I'm following my culture, but it's affecting my kids. It might affect my kids mental health,
Sure.
because screaming is not going to affect positively my kids. So I can give you one example. When I was doing a Zoom session with one of the childs, the mother was very anxious about child's behavior. But when I saw her screaming and then talking in a very like rude way, so I told her that I want to talk to you in private, not in front of your child. And then
Mhm.
I educated her that you are modeling how you are
Yes,
behaving. Your child is doing the same thing, but you are
exactly.
not accepting what your child is doing, but you're okay with your behavior.
Yes,
And
exactly.
she was very positive. She took it very positively, and she said, okay, I will work on it.
Excellent, excellent, excellent. I love that. I love that. And so this sort of gets us to the point where, in terms of benefits, right? So for
Mhm.
example, I've met persons who have just working in the field, meeting a lot of persons who have mental health challenges, and the whole stigma attached to not wanting to get labeled. So saying things like, oh, that's because I'm a Pisces, right? They say that I just behave emotionally because I'm a Pisces. It's nothing serious, right? But recognizing to themselves that if I have to lose it every time I have stress, meaning scream and shout and throw things down, as you said with the child, it's not appropriate. It's not the most effective way. So what
Mhm.
are the benefits of actually getting mental health help? What are the benefits in your opinion?
Yeah, it's not, there are many benefits, but the most important thing is we can empower people to show them their mental strength, or they can improve their mental strength so they can handle stress more effectively without screaming. We don't have to label them that, okay, you have this disorder, because people are scared of labeling, right?
Sure. Yes. Yes.
So we don't what we it's not necessary that we need to label them, but just we can help them to understand that uh, that, for example, if somebody is showing aggressive behavior,
Yes.
verbally very aggressive, so we can just help them to understand that there are other ways to show anger, and anger is completely normal emotion. It's a
Yeah.
primary emotion. Everybody gets angry, but only we have to learn how to express our anger in a better way, so we cannot hurt ourselves, and we can also save other people.
Sure.
Like, yeah. Mhm.
Sure. That's definitely a very big part of it. You know, as we do here at the Robinson Lloyd Resiliency Group, you know, we focus a lot more on education, right? Education. That's actually my little girl knocking on the door. So I'm going to
Yeah,
open
I
for
can
her.
hear it. Mhm.
Yes, parts of the online, parts of the online life.
That's okay.
Yes,
For kids, everything is
yes.
acceptable. Mhm.
So, so I'll go attend to her. But you know, just to thank you so much. You know, I was saying that we focus on the health parts of educating and sharing and you know, coaching and counseling and it's I think it's very just experiencing it, you know, from the perspective of working with others. I find that they are more accepting because this is just, you know, I'm just making myself better. I'm just getting better, and
Mhm.
there's nothing wrong with doing that.
Yeah, it's a kind of self-care.
Exactly,
Mhm.
exactly. So Dr. Seif, I want to thank you so much for your time, your
Thank you. Thank you
your
for having
wisdom.
me.
It was great. And we look forward to having you on the, you know, continuing with us with the program, the Resilient Stars program. We know that you have your own private practice. So please, before you go, can you just share with us how could people get in touch with you know, for your private practice? Where are you located? And we're also going to add that information in the Zoom link below, in the
Okay,
YouTube
yeah.
link below.
Okay, so my private practice is in Newark, downtown Newark. It's 290 Ferry Street. And I'll give you the phone number so you can add in the link. Okay.
Perfect. That's wonderful. Thank you so much again, Dr. Seif.
Thank you. Thank you for having me. Have a good
You
day.
too. Okay.
Bye-bye.
Bye
Thank
bye.
you.
Thank you.
Bye-bye.